This is the human immunodeficiency virus, the virus that causes AIDS. Globally, over 36 million people have died from AIDS since the epidemic began. When acquired immune deficiency syndrome was diagnosed in the early days of the disease, the prognosis was certain death soon. There was only one drug to treat the symptoms, and the side effects were often the cause of death. Mitzi Teliczan, public health educator for Buchanan County, Missouri, says there are now over 40 combinations available.
Oh my goodness, over the past 30 years we've seen some major advances in the technology, the medications, the treatment, all that kind of thing. HIV is a very complicated infection. There's not just one thing that might work. It's usually a combination. And in the early days there might be one pill, one treatment that a person could take should they be diagnosed with HIV. And now we have somewhere in the neighborhood of 30 to 40 different combinations of these life-saving drugs that kind of bombard that virus from all directions and keep it from multiplying as quickly, therefore decreasing the amount of damage it can do to a person's immune system. So there's just been tremendous advances over the last many years.
People in St. Joseph and surrounding areas have the same tests and treatments available as people in major cities like New York or Los Angeles.
We've been able to keep up with the testing technology and try to keep abreast of the new prevention strategies. It's great with the new medicines that can actually slow down the damage that HIV can do. I mean, there's no end to how long a person could live.
While treatment options have significantly improved, the best option is still prevention. There are several condom choices available: latex, skin, polyurethane, and there's a condom for women now.
There's also a female condom that is made out of this polyurethane material versus latex, and that's been a really good option for some women that I've spoken with, because not only is it a protection that's worn on the inside of the body, but it's not a latex product. But one of the things on the horizon I'm so excited about is called a microbicidal gel. I think I pronounced that correctly. And it's supposed to be a vaginal gel that can actually be inserted prior to sex. And that gel would kind of form this protective lining around the vaginal tissue and could prevent not only infection with HIV, but possibly even some other sexually transmitted infections as well. Another very hopeful thing that's out there is treatment called PrEP and PEP. The PrEP intervention is basically where an individual would be given high doses of some HIV medicines in an effort to prevent infection with HIV ahead of time. There's also an intervention called PEP, and that's offered to a person after they've been exposed.
Advances in technology and medicine have made possible many things that were thought impossible. Scientists, doctors, and pharmaceutical firms are all working diligently to stop the spread of diseases. Polio, smallpox, and chickenpox have been almost eliminated with a vaccine by those working towards a cure. There will be a cure for AIDS and a vaccine against the human immunodeficiency virus one day.
I will say that I believe that we're very close. I think research is ongoing and people are trying very hard to develop a cure for this virus. I hope I see that in my lifetime. I hope I see that in my lifetime.